Now this is a beautiful picture holding each one's hand. So I expect in your studies, in your friendship, in the campus, you hold hands together. You have left your father's and mother's hand. Now your friends are there. Okay. Now articulation. Now you just, I told you the other day, the elbow joint with the superior radioulnar joint. Naturally, the wrist joint is the inferior radioulnar joint, and the bones of the hand. Now, distal end of the radius and the articular disc, ellipsoid concave surface. You can see this. Now, scaphoid, lunate and triquetral, ellipsoid convex surface. When you see the articulated hand in the department, the skeleton, Vivek, articulated hand ওখানে কটা আছে? 4-5টা আছে। বেশ, তোমরা ইস্যু করবে and you can see the bones. আমি একবার ওই হিস্টোলজির ফাঁকে বা নেক্সট লেকচারের আগে আমি একটা দুটো ছবি দেখিয়ে দেবো। How to remember the hands bones and also the foot. An easy way of remembering. Now this is the dissected specimen showing the head, and you can see the phalanges, and this is the metacarpal bone, these are the carpal bones, and you can see the medial ligament, styloid process. This is styloid process here for the radius, and this is the lower end of the ulna. This is the head of the ulna. Articulation type synovial ellipsoid. Synovial ellipsoid. And capsule includes the joint, includes the articular disc. There is an articular disc. Because of the functional aspect of the hand, I told you, see, you can do many things like this. You can do like this. You can do like this. You can give a slap with your hand. Also, you are, if any one of you are experts in martial art, judo, karate, the hand, legs, of course, comes into. She is a martial art expert. Okay, then I will expect you to this thing, give a show in the auditorium. Okay. Now, the ligaments. What are the ligaments? Anterior and posterior radiocarpal ligament, the medial ligament, styloid process of the ulna and the triquetral bone, and lateral ligament, styloid process of the radius and to the scaphoid bone. So you see, the bones are pieces. Now that has to be attached and kept in this form. Okay. Now, what I want to stress is that you just have a concept. If there is a lateral ligament, there is a medial ligament. And the anterior and posterior radiocarpal ligament. The anterior and posterior. So that gives a support. Synovial membrane lines the capsule. The joint cavity does not communicate with the distal radioulnar joint or the intercarpal joint. Now, it is lined by a capsule. So, that is not, the joint cavity does not communicate with the distal radioulnar joint or the intercarpal joint. These intercarpal joints, they don't communicate. Now movements, it is flexion, extension, abduction, adduction and circumduction. So you can see all the movements are there. All the movements are there. Naturally, movements, what are the movements? Flexion, extension, abduction, adduction and circumduction. Like this. Okay? Now movements, flexion. For flexion, the flexor carpi radialis, the flexor carpi angularis and the palmaris longus. Now for flexion, your flexor carpi radialis, this side, angularis and assisted by the flexors of the digits and palmaris longus. When you dissect the palm and the lower radioulnar joint, you can see the structure, see the ligaments, and see all the tendons. That is, now you can see this is the flexion, this is the extension. Now, why it is important? See, if anyone is having an accident or some neuropathy due to some trauma or some disease, then the nerve supplying the wrist and the muscles and the tendons, that gets affected. So you have to, just say when a person comes with a stroke, okay, now say right-sided hemiplegia, then you, in the clinic, you hold her hands, hey, haath dharo. Then you see the paralyzed part, he cannot lift anyway, you hold it. Or hemiparesis, hemi means partial. Now still some muscles are functioning, so you ask the patient, hold it. And you just say, press. Jode jode, tipe dharo, aro dharo. Then if it is on the right side hemiplegia or hemiparesis, then you can gauge how much loss is there, the weakness of the muscles, how much is affected. Now, accordingly, you have to manage that thing. So you have to know, these are the quick tests. You have to know, again when you go to your clinics, you'll be like Hutchinson's Clinical Methods. It's a book. When you do medicine, you will be reading that book. Or many Indian authors are writing, I don't have an idea. But you have to again go back to your anatomy. You know your fundamentals, anatomy, you will physiology and your biochemistry. Now movements, abduction, flexion carpi radialis and the extensor carpi radialis longus and brevis. Adduction, flexor and extensor carpi ulnaris. So you can see this line, midline. Now this is abduction, it is like this, and this is adduction. Now circumduction, wrist joint rotation. See, you hold it like this and then you just do this. Now, this is a very common fracture, especially aged ladies. Okay. And what happens? You skid. Suddenly that lady is walking like this and skids. What's the first nature's reflex is that she will try to protect in an outstretched hand. Outstretched hand. Naturally, that pressure, practically the whole body pressure goes into that. Naturally, that cumulative effect is the fracture callus. And you can see this, the person. Now this is the College fracture, fall and outstretched hand, transverse fracture, distal end of radius and lower fragment displaced upwards and backwards, dinner fork deformity. You have, do you know the dinner fork? And it is like that. And when radiology was not, it was there, but in early 70s, 80s, in these towns, there were only two machines, two X-ray machines in the district. That is one in Shuri, a senior person. He had a X-ray machine, and we at a later stage, my father bought a X-ray machine and we placed it there. Now this whole district, there was no this thing. Now what happens actually? Then people got treated with chichropaths or bone setters. Now you see what they used to do is that they put a herb, the hard joda lota. When it's a plant, they just tie it and put 2 or 3 bamboo sticks cut in and put a splint. And in between, if he was an expert in chichropathic practices, then he presses. And what we used to do, in a college fracture, but there was no anesthesia in those days. So you catch hold of the hand and, hey Vivek, what happened? Now see, imagine that he has a college fracture here. Okay. Now what happens? It is like that. The bone is displaced, the fracture fragment. So what? You hold like this in glass holding position. Then it becomes functional. And see, now he was like this, dinner fork. Naturally, there's no movement. Now once you hold it like this, flex and ask any person, assistant or some person who's standing, you just ask him to hold it tight and you just pull like this and you just press like this with this palm. You will hear a noise, crack. And also to the deformity to some extent goes. And the pain is relieved and you start, hey, move your fingers please, then it moves. So this, nowadays, if you, but at least what I would suggest, in an emergency, you give injection and all this, whatever, first aid, X-ray. Now your orthopedics, you have to send to the orthopedics outdoor. That goes on. Let it go on. That will be a practice. You have a radiological investigation and everything. And then you try to just press a little bit. Hama, takuma, didima, nago. You just pamper her to some extent. There, it will be reduced. You give a plaster cast. If you don't have a plaster cast, you just make this hard cardboard, this your Amazon, Nika, these boxes. You just fold it, put cotton and place it. At least give your motto is that you give a relief to that old lady. Now, this is one thing. What is happening now? Nowadays, modern orthopedics. What is modern one? What is old? At least I don't believe. Now in orthopedic practice, there is a tendency for the newer generation. At a tar bene debo, at a screw kore debo, at a plate lagiye debo. You have to be very judgmental. What type of fracture it is, where a screw is needed, where is wire is needed, and where a plate is needed. You have to be judgmental, and you have to be judgmental regarding the age. Age is a big factor. Due to osteoporosis, there are many this thing at this old age, 85, 75, 65, 55, this age group. If you don't do an open reduction, you can go for a closed reduction. Even very renowned orthopedics doctor, that can be done under anesthesia. Now GA or finally your brachial block. Everyone is not an expert in individual nerve block. So according to the situation where you are posted, we just put a slab, put some support, kichu na hole at a Gramin hospital asho, we can put a basket in the wooden scale, scale, 1 foot, the foot scale, and wooden. You put 2 of them and just bandage, put cotton, be it comfortable and transport. Okay? Now, and see, once you reduce, I have done many. It's immediately, she moves the fingers, then you, after doing all this procedure, you just can go, you have given injections and all painkillers, but you can do a placebo therapy. You just give one B complex tablet or capsule. Ma, eta khaye na, Didi ma, eta khaye na. You tell her to hold the glass and she drinks. Ha, Baba, take it. Placebo is a therapy. In a sense, if you, like in homeopathy, it is phytum. They take sugar of milk and those globules. If you understand that you have diagnosed that she is not having any organic problem or some problem, a grievous problem, then you give her phytum. Homeopaths give phytum. That it is not a medicine, but it is just a sugar of milk and a bit of, they use tincture, this alcohol, and dine 10 phota kore, the daily you take 5 drops thrice daily under your tongue. Then next week, 10 din pore, you come after 10 days. Kemon achen? How are you? Bhalo achi. So, there is a book, Placebo. I will try to get the author's name and tell you. If you are interested in reading or you get any book, Google Baba, he will tell you. Okay? Now, dinner frog deformity, this is the condition. Here is the fork and see this thing. Now, Smith's fracture, reverse of Colles fracture outward and Smith's fracture inward. Now, Smith fracture you have to reduce. At least you give a support and send it. So it can be reduced in a because it is needs anesthesia or this thing. And nowadays it is easy. It's easy because CR X-ray. Whatever you are trying to reduce, whatever you are putting a plate, a fracture, or are you putting a rod inside, that you can view in this thing screen, if that thing is going in straight. So you use technology accordingly, and joint is the union of two or more skeletal elements, bone or cartilage. Chief function of joint is determined by the tissues of which joint is constructed. In great majority of the free articular surface slide, spin or roll over one another, there being no other tissue interposed between them. Movement in such joint is facilitated by lubricant called synovial fluid called synovial joint diarthrosis. Okay? So only it has to glide. Naturally, there cannot be other tissues interposed between them. Fat or some muscle or some ligaments inside the joint. In remaining non-synovial or synarthrosis, there are no free surfaces and connective tissue of considerable strength unites osseous surfaces. Okay? Synarthrosis. Such an arrangement precludes movement. Some angulation and distraction are occasionally possible. It helps growth and may permit molding during childbirth. Differential growth, transmission of forces, compression, shear and movement from consolidation and complete rigidity at one extreme to relatively free but controlled movement at the other. False joint, continuous bone connection in which intervening tissues consist of fibrous connective tissues, cartilage or bone. No to low, moderate mobility, no mobility or low mobility, moderate mobility. Synarthrosis, sutures, gomphosis. Sutures, gomphosis. Syndosmosis, fibrous. Synchondrosis, cartilaginous. Chondro, cartilaginous. Symphysis, fibrocartilage. Synthosis, bony fusion. Atypical cartilaginous joint. True joints, discontinuous bone connection in which joint cavity is separated by a space. Now, these are false joints, true joints. It can be a short note. True joint and false joint. It can be a short note, and you know these synarthrosis, gomphosis, syndosmosis, synchondrosis, symphysis, synthosis, atypical cartilage joint. Now these terms can be in your MCQ. Okay? Now, discontinuous bone collection in which joint cavity is separated by a space. Diarthrosis. Criteria, shape and arrangement of articular surface, number of joint axes, number of degree of freedom. Ampliarthrosis, stiff joints, mobility gently restricted by strong ligaments, external proximal tibiofibular joint and sacroiliac joint. Now you see the tibiofibular joint and the lateral aspect. You see it's just over here. The head of the fibula, the lower end of the fibula, it gets joined there, but that doesn't have much mobility. Okay? And your structural classification, fibrous joint, cartilaginous joint, synovial joints. Just a revision. Classification joint, functional classification, synarthrosis, amphiarthrosis, and diarthrosis. Okay? Now, embryonic development. Embryonic condensation of mesenchyme either in sheets of form cartilaginous template of bone, the mesenchyme remaining between developing bone represents primitive joint interzonal, determining the type of joint that will form, fibrous or cartilaginous or fluid-filled cavity. Classification of joint, fibrous joint, synarthrosis, immovable, cartilage joint, amphiarthrosis, slightly movable, synovial, diarthrosis. Fibrous joint articulating bones are joined by fibrous tissue. Fixed joints with no movement possible. Subtypes, sutures, syndosmosis, gomphosis. Now, bones are bound together by sharpish fibers. In this is the suture. Present in skull bones, absolutely immovable, fuses at birth, craniosynthosis. Okay? Types of sutures: serrate, sawtooth, appearance of edges, sagittal. The two parietal bones, they meet, the sagittal sutures. The occiput meets here. Now, that is having, it's a sawtooth. When you go to the dissection hall, see the skull and you will see denticulate, the margin present teeth with tips being broader than the roots. Example, lambdoid. Okay? Yeah. Squamous and limbous. Edges of the bone united by overlapping. Example, parietal and squamous part of the temporal bone. In the parietal bone, you see today in the skull, the temporal bone overlaps it. But that is the suture. It overlaps it. So it can, because the temporal bone has the inner ear, the stapes, malleus and incus, that is protected in the petrous part of the temporal bone. Now, nature's क्या बोलेगा लीला see this now plain borders united by sutural ligament, example between palatine process of two maxillar bones. When you see the skull from the undersurface, the palatine process, and the plain borders united by sutural ligaments, some ligaments, and between the palatine process of two maxillary bones. Wedge and group sutures or synovial. Synovial. Here. This is hormone, and these are the fibers. Okay. Now, syndesmosis. Bones are connected by connective tissue, interosseous membrane. Here, the radius and ulna. The radius and ulna. It is tibia, fibula. Tibia and fibula. This is syndesmosis. Very slight movement possible. Middle radioulnar joint and distal and inferior tibiofibular joint. Okay, but this is a fibrous element. You cannot hook hard at a blow, injury to the forearm, then either one bone radius or ulna gets fractured or both bones. Now, if it is one bone, you can conservatively treat it previously. But nowadays, plate, screw, whatever it is suitable. But both bone fractures, even earlier, when there is no modern orthopedics, so plaster and accordingly it used to get bit deformity or. Now, comphosis, dental alveolar joint. This is the socket and this is the root of the tooth and periodontal ligament here. Fibrous connection between tooth and socket is periodontal ligament. Movement possible is minimum. Buddha ho jayega. So with age it is with this thing. And but when you see the extraction, you have some problem in the first, second molar or something. The dentist literally what kusti করতে থাকে তারপরে they have two levers like thing, they put it, they give stitches. So it is not that your teeth are not diseased. They are quite interesting. Kebab, mutton korma, you are just going on for a feast. Now, cartilage joint, articulating bones are joined by cartilage, hyaline or fibrous. Movement is possible more than fibrous joint but less than synovial joint. Sometimes primary cartilage joint, secondary cartilage joint. Now see, primary cartilage joint, synchondrosis, bones united by plate of hyaline cartilage. Yeah. With age, cartilage is ossified temporary joint. Examples: first chondrosternal joint, costochondral joint, zipisternal joint, and spino-occipital joint. Now, the mandible and the body of the sternum, if they are both separate, then with age, this becomes your ossified, the cartilage ossifies, and now secondary cartilage joint symphysis, midline. Articular surface united by disc of fibrocartilage. This is the disc of fibrocartilage. Permanent joint and persists throughout life. Example: symphysis pubis, manicrosternal joint, and intervertebral joint. Now, this can be a short note even. 2 marks. Okay. Intervertebral disc, cartilage joint. Each disc consists of annulus fibrous at periphery and nucleus pulposus in the center. Nucleus pulposus in the center. And this is the annulus fibrous. Annulus means ring-like. Between the two vertebrae, that's a cushion-like, the cartilage. Okay? Each disc consists of annulus fibrosus at periphery and nucleus pulposus. Acts as a shock absorber, offers resistance to compression and even distribution of compressive force. Until it is you have a very big a trauma. Actually, that nature tried to protect you. Okay? Body te dekhbe আর skeleton-টা দেখবে। Yeah. তোমরা যখন vertebral column পড়বে, when you read vertebral column, you see the skeleton in a group and see what are the structures and where the nerves and vessels, how they are traversing. You correlate with your dissecting manual or your atlas. Disc prolapse. Now yet there's a disc prolapse. So you fall or you just, it happened to me that I was in the bathroom, I tried to pick up a bucket of water and I had a prolapsed intervertebral disc. I had to lie down for 6 months in bed. But the neurosurgeon and my Dr. Manus Bhattacharya, who stays in Bolpur, he's senior to us. We, under his supervision, I was being treated and I didn't need a surgery. So, cartilage joint symphysis pubis, see, here. The anterior arch of pelvis composed of pubic bone and their superior rami acts as a tie beam and prevents separation of posterior arch. It acts as a shock absorber. See this. This posterior part is a shock absorber and this is the symphysis pubis. Sometimes it may show presence of a sagittal fluid cavity. Now, one thing to tell you, previously in like obstructed delivery, in primitive age, also common practices in Africa, India, they used to slit open the joint symphysis pubis and then make the passage more wider. That was not the pre-cesarean era. Okay. Now, mandibulosternal joint. The body of sternum makes pump handle movement. When you read the respiration and diaphragm, you will be coming across this pump handle movement. It can be a small short note. Horizontal cleft may be present. May face synthosis. Symphysis menti. This is the mandible, symphysis menti. Atypical cartilage joint, many junctions in the body with features of joints do not fit into the classification. So, atypical cartilage joint, many junctions in the body with features of joints do not fit into the classification. So, that is another group is atypical cartilage joint. Bone and with cartilage, here. Cartilage to cartilage, here, the larynx, this thyroid cartilage, and suture, nasal, laryngeal, costal, auditory tube and pinna. This synovial joint, most mobile type of joint, articular surface covered with hyaline cartilage. Joint surface is joint cavity filled with synovial fluid. Synovial joints, most evolved and mobile type of joint. Characteristics, yeah. See, this is ligament. This is articular hyaline cartilage. This is the bony end. This is the joint cavity. Contains synovial fluid. The articular capsule, fibrous capsule and synovial membrane. Articular cartilage, cavity filled with synovial fluids. Synovial joint can come as a short note. Articular capsule, outer fibrous and inner synovial membrane. Ligamental support. Articular disc or menisci. Most of the joint is hyaline cartilage except in some fibrocartilage. Here, a beautiful picture of the knee joint. This is the lower end of femur, this is the upper end of tibia, and this is the hyaline cartilage. Reduces friction as a shock absorber, where resistant, low friction and lubricated. Now, the structure of the synovial joint, you can see the articular cartilage here, bone, this is the periosteum, this is synovial membrane, and joint capsule, the capsule. Avascular, non-nervous, elastic in nature and inherent slippery. Circumferential dimensions are opposite on approximate features, surfaces. It is indispensable. Young and old cartilage. Functions: provides smooth gliding surface and reduces forces of compression on weight bearing. Regulation of growth of epiphysis, structure and changes. Chondrocytes and collagen fibers from territorial and interterritorial matrix arranged in 3 layers. Here, the calcified cartilage and subchondrial bone, zone 1, zone 2, zone 3. That's degenerative and protective changes occur in cartilage in advanced age. Okay. Nutrition. Articular capsule consists of outer fibrous layer and inner the synovial membrane covering non-articular surfaces also. This is the head of the humerus, the portion of the muscle, rotator muscle, glenoidal cavity, capsule, and this is the acrement process cut off to expose the shoulder joint. Very vascular nervous and may have apertures. Capsular ligament, extra or intracapsular tendons. See the synovium and the tendon, and it acts as a pulley. This functions. Binding of bones, support to synovial membrane, watchdog action. Synovial membrane, synovial joint, a healthy joint, synovial membrane, you can see the cartilage here, the bone, synovial fluid in blue, cartilage in red to brown, Rangamati, the soil of Birbhum. Okay? Highly vascular, non-nervous and cellular connective tissue, membrane with lines inside the capsule of the bone, tendon, intracapsular ligament and bursa except cartilage and disc. Here. See the fibrous joint capsule, the synovial fluid lubricates the joint, synovial membrane produces synovial fluid, tendon, joints, muscle to bone, enabling movement. Structure, pink, smooth and shiny cells of membrane and arranged in two zones, inner and outer. Functions: secretion of synovial fluid, liberation of hyaluronic acid and removal of particulate matter. Type: fibrous, areolar and adipose. Synovial fluid. Now, this is a cross section of shoulder joint. This is acromion. This is the bursa. This is the coracoid process. This is the clavicle. This joint capsule with fluid and cartilage and humerus. This is the scapula. Low volume, pale yellow, viscous alkaline fluid. Diazylate of plasma, which is added with hyaluronic acid. This is the synovial fluid content. What is the composition of synovial fluid? Hyaluronic acid is responsible for viscosity, functions, nutrition, lubrication of cavity and wear and tear, elastic fluid film, weeping, lubrication and boosting effect of lubrication, environmental temperature, viscosity, more movement, more lubrication. Now ligaments. Now you can see these ligaments here. Coraco-acromial ligament. The coracoid process, the acromion, this is the coracoid process scapula, this is the acromion. Now this is the coracoid. Subacromial bursa, that's the bursa there. Coraco-humeral ligament. From coracoid process to the humerus, greater tubercle of the humerus, is transverse humeral ligament. This is the subscapular bursa and articular capsule reinforced by glomerular ligament. Tendon sheath, this is the tendon of long head of biceps and brachii, and this is the scapula. It may be true or accessory. It may be intra or extracapsular, intra or extra synovial. May show phylogeny. Functions: permit desirable movement. Stability. Articular disc, menisci, fat pads and labra. Joint cavity sometimes divided by fibrocartilage disc into compartments due to low congruence. Division may be complete. The jaw joint, sternoclavicular joint, inferior radioulnar joint, or incomplete knee and acromoclavicular joint. Here's the hand and the wrist. Now, temple bone. Now, this is the knee joint functions. Lubrication may by maintenance of interval, gliding and angular movements, prevention of wear and tear of the articular cartilage. Why articular cartilage differs from typical hyaline cartilage? Articular cartilage is devoid of perichondrium, more avascular nutrition through synovial fluid, does not regenerate, does not undergo ossification with age. The articular cartilage differ from typical hyaline cartilage. Now, classification, criteria for classification, according to the number of articulating surface. Simple, only two bones come in articulation, example, interphalangeal joint. Okay, yeah, interphalangeal. This is. Compound more than two articular surfaces and share a common articular capsule, example, elbow, ankle, radiocarpal joints. Here's the picture. Complex joint cavity divided into compartments by articular disc or menisci, knee and sternoclavicular joint. Here's the picture. According to axis of the movement uniaxial, it has 1 degree of freedom, example, elbow, ankle and interphalangeal joint. Uniaxial joint. These are examples. is that it has 1 degree of freedom, example elbow, ankle and interphalangeal joints. Biaxial joint, it has 2 degrees of freedom, example radiocarpal and metacarpal phalangeal joint. Polyaxial joint possesses 3 degrees of freedom and morphologically called as ball and socket type of joint, example shoulder, hip and talocalcaneonavicular joint. Talus, the bones of the foot. Now, calcaneum and navicular is the bone. Now, polyaxial, biaxial, uniaxial. That can be a short note also. Now, plane of synovial joint, articular surfaces are flat. You can see, yeah. Permit gliding movement. Permit gliding movements, example intercarpal joints, intertarsal joint and joint between articular processes of vertebra. Hinge joint, articular surfaces and pulley shaped movements permitted in one plane around transverse axis. Examples, elbow joint, ankle joint, knee joint, modified hinge joint. This is modified hinge joint and interphalangeal joints. Pivotal joint. Pivot joint is the articular surfaces comprised of central body pivot surrounded by osteoligamentous ring. Now, osteoligamentous ring. Movements permitted in one plane around vertical axis. Example, superior inferior radial joint and median atlantoaxial joint. Now, atlantoaxial joint. That is when you go to the head and neck. That is it's a pivot joint. Now, condylar joint, ovoid articular surfaces. Condyles fit into an elliptical cavity. Permit movements in 2 planes, flexion, extension, and rotation as possible. Example, temporomandibular joint and atlanto-occipital joint and radiohumeral joint. Ellipsoid joint, convex articular surfaces fit into concave cavity, permits movements in 2 planes, flexion, extension and adduction possible. Example, metacarpophalangeal joint and the wrist joint. Saddle joint, articular surface of reciprocally concavo-convex, movement possible in multiple axes, flexion, extension, adduction, abduction, rotation. I mean, just at a jhorer moto beriye jacche to get an impression what you have taught. You will be again just example first, carpometacarpal joint, sternoclavicular joint, and calcaneopivotal joint. Now, ball and socket joint. Okay. Gliding, angular movements, circumduction, rotation, factors limiting range of movement. You just see shapes of articulating bones, factors maintaining stability of joint, pony configuration, ligament muscle. Bursas, bursa plural bursae, bursus Latin bursa synovial is a small fluid filled sac lined by synovial membrane with an inner capillary layer of slimy fluid similar to that of egg white. Winter is there, you will be using egg white as in the soup. Okay. Now, see all these bursa. Now, sometimes the injection is given in the bursa here. Now, these are the common dislocation, subluxation, sprain, arthritis, rheumatic fever, rheumatoid arthritis, osteoarthritis, septic arthritis, fracture of joint space, stiffness, neuropathic joint. Thank you.